Botulinum toxins typically last between 4 to 6 months. It really depends on how often you've had it done before and whether you're a quick or slow metabolizer. For example, somebody who's had toxin injections put in quite regularly might sometimes develop antibodies to that. So over some time, it degrades faster and it may only last 4 to 5 months. In another patient, for example, it may last for longer duration, typically about 6 months or maybe a little bit longer than that. Again, it also depends on where the toxin has been put into. So if you put into an area of high muscle movement, somebody who uses the muscle very often would tend to break that down much faster as well. Would not be able to see immediate results after botulinum toxin injections, but typically they happen very soon. So sometimes between 3 to 5 days, you will start noticing the effects of it. And typically I get patients to come back about a week out or about 1 to 1.5 weeks so that I can tweak the injections at that point of time. So if necessary, I'll do a top up at that juncture. If not, then they're all good to go. That's because usually you want to wait for the onset of botulinum toxin and it typically may range from between 3 to 5 days or so. I think botulinum toxins are very safe. Done in safe hands that absolutely give very good results. I think the main issue sometimes is with diffusion of the botulinum toxin. So if you put toxin in over the forehead, for example, and you go too low, sometimes it might diffuse into the next muscle zone, and that's when people get a little bit of droopy eyelids. Also, sometimes if you do a lot of the toxin injections in the neck area to treat some of the platysmal bands, if you use a very high amount of botulinum toxin, sometimes they might get a little bit of weakness in the neck area in terms of like sort of like sitting straight or turning the neck. They might have issues with that, or sometimes it might diffuse, it might affect a little bit the vocal cords, but generally not life-threatening. It's mainly the concern is largely from the diffusion of the toxin into another muscle group that you didn't want to treat. Botulinum toxin injections and filler injections are two completely different class and they're very, very different. Oftentimes they're used in combination and used in the same patient, even in one sitting. So sometimes patients tend to lump them together and they call them injectables as a whole. They are different forms of injections, but botulinum toxin is really a neuromuscular toxin injection. So what it does is really to control dynamic muscle activity. You put it into areas where you really want to reduce dynamic muscle movement. So for example, you put it in over the forehead, that will help to reduce the formation of static forehead lines, which sometimes form over decades, and you get these edge lines that some people don't like. Now, on the other hand, filler injections usually by and far fall into a category of hyaluronic acid injections. Typically, this is used to volumize, and very often it is used sometimes also to fill fine lines that you get from static wrinkles. The other common indication for filler injections would be skin hydrating boosters. So typically they're put in the skin in a very, very superficial level. They draw a lot of water, they plump the skin. So you can see that with filler injections, there's a wide variety. Typically, I classify them as hydrating fillers or volumizing fillers. And then when you talk about toxin, they stand alone. They're really to control sort of frown lines, wrinkle lines, where there's a lot of dynamic movement going on. Botulinum toxin injections and filler injections absolutely get degraded over time. So your body will clear them out and they get flushed out from the system. For example, if you use hyaluronic acid injections as part of your filler injections, they are broken down by a naturally occurring enzyme in the body called hyaluronidase, and that really degrades the HA gradually over time. So typically, most filler injections will last between 6 months to up to about 9 months or so, and it's completely cleared out. With botulinum toxin injections, again, they are also degraded by the body, and over a 4 to 6 month period, they are also flushed out from the system. Now, there are some injectables in the filler category that may not be that degradable. For example, if you use something that is based out of calcium hydroxyapatite, or in the old days, sometimes people use collagen injectables, then these are injectables that have a variable duration of longevity, and some of them may not be as easily flushed out from the system. Chemical peels can absolutely help manage photoaging. It's really useful from the perspective of actually taking away the top layers of the skin. So again, chemical peels can vary depending on the depth of the peel that you institute. They're very superficial peels, very mild peels. There's medium depth peels, and there are also deep peels. So they're used for varying indications. Now, usually in today's practice, because we have so many other options available, most of us don't tend to do a lot of deep peels. Deep peels were used in the past more for like really deep acne scars. They were known as the phenol peels, and that's really sort of outdated at this current point. So most of the time when we use superficial to medium depth peels, they're really useful for photoaging, really useful for pigment damage as well. They really sort of like clear out the top layers of the skin. You shed them, it increases cell cycle turnover, it gives you a fresher, younger skin. The difference between an aesthetic doctor and a dermatologist really is that dermatologists are specialists, and the specialization is really in the field of skin, hair, and nails. In this part of the world as well, dermatologists also are venereologists, so we do manage sexually transmitted infections as well, on top of the overall health of your skin, hair, and nails. On the other hand, when somebody refers to an aesthetic doctor, many times it's probably somebody who has really branched from general practice and has gone more into beauty treatments. Oftentimes they overlap in terms of some of the treatments that they may utilize in their toolkit, which a dermatologist will also use as well. Now, when we talk about the field of cosmetic and aesthetic work, I think people oftentimes jumble up plastic surgeons, dermatologists, and aesthetic practitioners. Plastic surgeons and dermatologists are specialists respectively in their own fields, and aesthetic medicine hasn't been recognized as a specialty. It's a very loose term to describe the practice of maybe aesthetic medicine, the art of making people look beautiful. So I would say that most of the time, by and far, in this country or in this region, a lot of them are more general practitioners who have an interest in cosmetic rejuvenation. On the other hand, dermatologists manage medical issues as well. So typically, a lot of us who manage more serious conditions like skin cancers, we will be more astute in the management of maybe even blistering conditions in the elderly, pediatric conditions as well. So overall, we manage the overall health of the skin, not just the aesthetics or the cosmetic part of that. Well, the pregnancy glow that people talk about probably is really a result of having a surge or different amount of hormones circulating through the blood system. So usually during pregnancy, there's a huge amount of hormonal changes, and some people usually have much healthier skin and hair during that period of time. So hair typically grows very, very well. You find that you get more voluminous hair doesn't fall or shed at all during that 9 months. This is because there is a shift towards a growth phase for your hair cycles, and the hairs actually don't release during that stage. So people feel good, they got bouncier, juicier hair. Sometimes the skin feels more supple as well. On the other hand, some people actually develop problems during pregnancy. So some people may actually have pigmentary issues like melasma first present during the first pregnancy, or they might also have pregnancy-induced acne. Again, because the shift in hormones are so great, for some women who've never had acne before, they develop pregnancy acne. On the other hand, people say they absolutely have a pregnancy glow. When they're pregnant, their acne melts away, they've got great skin and great hair. So that is honestly a rather variable situation. So in terms of what's really, really good for the skin and hair, I would absolutely recommend biotin. I think biotin is really great to boost hair growth. Helps to strengthen hair follicles. It helps to sort of like increase the growth rate of hair and nails as well. So if you want strong, healthy nails and hair, then biotin is definitely the way to go. And most hair supplements typically contain a fair amount of biotin. On top of that, the other important vitamins for good, healthy skin and hair would be vitamin B. I would think definitely other useful supplements include those with iron and zinc as well, because iron and zinc are essential for hair growth, as well as vitamin B12 on top of biotin, as I mentioned. With regards to skin, is collagen really, really good? I think it's harmless to take collagen supplements, but honestly, I think because collagen is a very big building block, it typically gets degraded and digested in the system, so it doesn't get absorbed as collagen in itself. So whether your skin forms collagen in the skin after taking a collagen supplement is still very, very debatable. So I would say definitely the core vitamins that I've mentioned are really useful. Otherwise, I think vitamin C is also great because it's an antioxidant. It does reduce oxidative stress. So I typically like vitamin C in terms of topical application, but of course, a high amount of sort of vitamin C in the system will not harm. I absolutely think that the lower amount of fragrance areas, the better. Generally, patients sometimes develop allergies over decades to various ingredients in cosmetic products, and sometimes fragrances are a common culprit. So if the fragrance is not necessary, I would take them out, especially from a skincare product. Now, on the other hand, I think that mineral oils are also good to avoid generally. They can be quite comedogenic, they can clog pores. So I would definitely avoid products that have high amounts of mineral oil, unnecessary fragrance. And again, I think parabens and alcohol should be avoided in products as well. Alcohol is generally dehydrating, it stings the skin as well. And in skin that's a little bit dehydrated and dry, it probably isn't very suitable.